Khabran Da Lekha Jokha, July 18, 2025.
Funding for 10-year-old girls' treatment to resume as Health Ministry reverses decision. The drug coverage for a 10-year-old girl on Vancouver Island who has a rare disease will be reinstated, the BC Ministry of Health has confirmed. This is a reversal of the ministry's announcement last month that it was discontinuing coverage for Charlotte Pollock's treatment. The drug Brineura is one of the only treatment methods for CLN2, otherwise known as Batten disease. While it is not a life-saving drug, it aims to slow the progression of the disease. I spoke to Charlotte's family earlier this evening. I confirmed to them that I have reinstated Charlotte's Brineura's coverage, and that coverage will be available to them for as long as the treating physician and the family deem it appropriate, Health Minister Josie Osborne said in a statement on Thursday. In June, the government announced it was discontinuing its coverage for the drug, saying it has clear criteria for initiation, continuation, and discontinuation, and the child has deteriorated to the point where there is no clinical evidence that continuing treatment would have further benefits. Charlotte's mother, Jory Fale, says she feels thankful and overwhelmed. I'm so grateful to everybody that has supported our family, she said. Charlotte, we love you and we are so happy. I'm so happy. Fale says she was told her daughter will receive treatment for as long as she needs. Last month's announcement had caused a public uproar. Laurie Brown, a president of Batten Disease Support and Research Association Canada, says public pressure certainly played a role in getting the ministry to reverse its decision. With all of the people in British Columbia and beyond, everyone who is supporting Charlotte and her family and speaking out, sending emails, writing letters, just talking about it, she says she is confident there won't be another interruption in funding. I feel like if they have come out and said this is the decision, I think this is going to have to stick, Brown said. Fales has been advocating for her daughter's treatment for years after Charlotte was diagnosed with Batten disease in 2019. The 10-year-old is the only person in province diagnosed with the condition, with around a dozen reported cases in the entire country. Thursday's reversal comes after more than a dozen U.S. doctors wrote a joint letter to Osborne and Premier David Eby urging them to reconsider the withdrawal of funding. I continue to strongly believe that decisions about care should be made by health experts to ensure they are based on the best available evidence, Osborne said. The letter I received today from Batten disease experts confirmed there is a significant disagreement between health experts on Brineura, and it is not acceptable that Charlotte and her family suffer as a result of that disagreement about the use of Brineura for Batten diseases. Brineura is estimated cost around $844,000 per year. The ministry says the cost of the drug was not a factor when considering whether to cover treatments.
10 ਸਾਲਾਂ ਦੀ ਬੱਚੀ ਜਿਹੜੀ ਕਿ ਰੇਅਰ ਡਿਜ਼ੀਜ਼ ਤੋਂ ਪ੍ਰਭਾਵਿਤ ਸੀ ਔਰ ਉਸ ਦੀ ਦਵਾਈ ਦੇ ਮੁਤਲਕ ਫੰਡਿੰਗ ਹੈ ਜਿਹੜੀ ਜੂਨ ਦੇ ਵਿੱਚ BC ਸੂਬਾ ਸਰਕਾਰ ਨੇ ਬੰਦ ਕਰਨ ਦੇ ਐਲਾਨ ਕਰ ਦਿੱਤੇ ਸਨ। ਉਸ ਦੇ ਮੁਤਲਕ ਕਾਫੀ ਜ਼ਿਆਦਾ ਪ੍ਰੈਸ਼ਰ ਪੈਣ ਤੋਂ ਉਪਰੰਤ ਹੁਣ ਸੂਬਾ ਸਰਕਾਰ ਨੇ ਆਪਣਾ ਜਿਹੜਾ ਫੈਸਲਾ ਉਸ ਨੂੰ ਬਦਲ ਲਿਆ ਔਰ ਉਸ ਦੀ ਜਿਹੜੀ ਟ੍ਰੀਟਮੈਂਟ ਆ ਉਸ ਦੇ ਬਾਰੇ ਮੰਤਰਾਲਾ ਮੰਤਰੀ ਨੇ ਬਿਆਨ ਦੇ ਦਿੱਤਾ ਹੈ कि जितनी देर तक एक्सपर्ट ते मरीज की जरूरत है उतनी देर तक जी दवाई की फंडिंग है जारी रहेगी। याद रहे फंडिंग बंद करन ते नाल ही उसकी मां वालों पकाए लगाई गई गुहार दे आधार दे उत्ते बेअंत लोगों ने सपोर्ट की ते नाल जिहड़ियां संबंधित संस्थावां सन उन्हां ने भी अपने जिहड़े ओपीनियन ने दिते उन्हां दे विच जिहड़ा फैसला सरकार दा बदलण दे विच काफ़ी ज़्यादा सहाई होए।
Retired BC nurse launches volunteer service to help ease healthcare challenges. While many wait for government fixes to BC's healthcare challenges, a retired nurse is taking matters into her own hands. After working at BC Children's Hospital for more than 2 decades, Mary Paone knows firsthand just how overwhelming the healthcare system can feel. That's why she's come up with the MyWell Help. The free volunteer-run website is built to help fill the gaps in the overstretched healthcare system. Paone says the online resource helps people organize their medical info, plan hospital visits, track prescriptions, and make the most of limited time with doctors. The project took 6 years to develop, she explains, with input from doctors, nurses, and social workers. Currently, MyWell is mainly designed for seniors and adults, but Bhavani's team is working on expanding it to other age groups.
ਔਰ ਇਹ ਜੀ ਹੈਲਥ ਕੇਅਰ ਦੇ ਖੇਤਰ ਦੇ ਵਿੱਚ ਆ ਰਹੀਆਂ ਦੁਸ਼ਵਾਰੀਆਂ ਦੇ ਮੱਦੇਨਜ਼ਰ 20 ਸਾਲਾਂ ਦਾ ਤਜਰਬਾ ਰੱਖਣ ਵਾਲੀ ਰਿਟਾਇਰਡ ਨਰਸ ਹੈ ਜਿਹੜੀ ਉਸਨੇ ਇਸ ਮੁਹਿੰਮ ਦੇ ਵਿੱਚ ਆਪਣਾ ਹਿੱਸਾ ਪਾਉਣਾ ਸ਼ੁਰੂ ਕਰ ਦਿੱਤਾ। ਉਹ ਕਹਿੰਦੀ ਮੈਨੂੰ ਪਹਿਲਾਂ ਫਸਟ ਹੈਂਡ ਇਸ ਚੀਜ਼ ਦਾ ਐਕਸਪੀਰੀਅੰਸ ਹੈ ਕਿ ਕਿਸ ਪ੍ਰਕਾਰ ਜੋ ਮੌਜੂਦਾ ਹੈਲਥ ਕੇਅਰ ਦਾ ਸਿਸਟਮ ਹੈ ਉਸ ਦੇ ਵਿੱਚ ਹੈਲਥ ਕੇਅਰ ਦੀਆਂ ਸੇਵਾਵਾਂ ਪ੍ਰਾਪਤ ਕਰਨ ਦੇ ਲਈ ਇਨਸਾਨ ਓਵਰਵੈਲਮ ਮਹਿਸੂਸ ਕਰ ਸਕਦਾ ਹੈ। ਉਸਨੇ ਵੈਬਸਾਈਟ ਹੈ ਜਿਹੜੀ ਪਿਛਲੇ ਤਕਰੀਬਨ 6 ਸਾਲਾਂ ਦੇ ਵਿੱਚ ਇਸ ਨੂੰ ਡਿਵੈਲਪ ਕੀਤਾ, ਜਿਹੜੀ ਕਿ ਡਾਕਟਰ, ਨਰਸਸ ਤੇ ਪੇਸ਼ੈਂਟ ਦੇ ਦਰਮਿਆਨ ਇੱਕ ਇਸ ਪ੍ਰਕਾਰ ਦਾ ਮਾਹੌਲ ਬਹਾਲ ਕਰਦੀ ਹੈ ਜਿਸ ਦੇ ਵਿੱਚ ਕਿ ਪੇਸ਼ੈਂਟ ਜਿਹੜਾ ਹੈ ਉਹ ਡਾਕਟਰ ਦੇ ਨਾਲ ਘੱਟ ਤੋਂ ਘੱਟ ਸਮੇਂ ਦੇ ਵਿੱਚ ਆਪਣੀ ਜਿਹੜੀ ਬਿਮਾਰੀ ਆ ਉਸ ਬਾਰੇ ਇਲਾਜ ਲੈ ਸਕੇ।
Supreme Court set standard for prosecutors seeking adult sentences for youth. The Supreme Court of Canada has established a standard Crown prosecutors must meet when they are seeking adult sentences for youth offenders. The court says they must prove beyond a reasonable doubt that the youth has the developmental age and capacity for moral judgment of an adult. Under the Youth Criminal Justice Act, youth have what is known as diminished moral culpability. The onus is on the Crown prosecutors to prove that principle doesn't apply to a specific offender. The Supreme Court was reviewing 2 Ontario cases in which youth offenders were sentenced as adults. It upheld one of those cases and overturned the other.
ਨੌਜਵਾਨ ਨੂੰ ਕਿਸ ਪ੍ਰਕਾਰ ਜਿਹੜੀ ਕਿਹੜੇ ਹੱਦ ਤੇ ਜਾ ਕੇ ਇੱਕ ਪੂਰੇ ਅਡਲਟ ਦੀ ਜਿਹੜੀ ਸਜ਼ਾ ਉਹ ਦਿੱਤੀ ਜਾ ਸਕਦੀ ਹੈ, ਇਸ ਦੇ ਮੁਤਲਕ ਸੁਪਰੀਮ ਕੋਰਟ ਦੇ ਵਿੱਚ ਜੀ ਨਿਗਾਹਖੋਰੀ ਚੱਲ ਰਹੀ ਹੈ। ontario ਦੇ ਵਿੱਚ 2 ਇਸ ਤਰ੍ਹਾਂ ਦੇ ਕੇਸ ਹੋਏ ਸੀ ਜਿਸ ਦੇ ਵਿੱਚ ਕਿ ਯੂਥ ਨੂੰ ਅਡਲਟ ਵਾਲੀ ਜਿਹੜੀ ਹੈ ਸਜ਼ਾ ਦੇ ਮੁਤਲਕ, ਔਰ ਹੁਣ ਇਹ ਦੇਖਿਆ ਜਾ ਰਿਹਾ ਹੈ ਕਿ ਕਿਹੜੀ ਵਕਤ ਤੇ ਜਾ ਕੇ ਔਰ ਕਿੰਨੀ ਲੈਵਲ ਦੇ ਉੱਤੇ ਜਾ ਕੇ ਜਿਹੜਾ ਯੂਥ ਹੈ, ਨੌਜਵਾਨ ਹੈ ਜਿਹੜਾ ਉਹ ਇੱਕ ਅਡਲਟ ਦੇ ਜਿਹੜਾ ਮਾਈਂਡ ਆ ਉਸ ਦੇ ਲੈਵਲ ਦੇ ਉੱਤੇ ਜਾ ਕੇ ਸੋਚ ਸਮਝ ਤੇ ਫੈਸਲੇ ਜਿਹੜੇ ਲੈਣ ਦੇ ਕੀ ਸਮਰੱਥ ਹੈ ਜਾਂ ਨਹੀਂ।
Canadian citizen who was locked up in UAE prison says he was denied due process and medical care. A trip to the Middle East ended horribly for a Canadian citizen who is now back home and speaking out about what he calls a lack of help from the Canadian government for allegations of poor treatment while inside a prison in the United Arab Emirates. I am still suffering from that experience, said Brantford resident Ghazwan Abdeli Jalil. I want policy and systematic changes to make sure no other Canadian is ever abandoned like this abroad. His ordeal began on April 25th of 2024 in a parking lot in Abu Dhabi, where he and another man, a UAE citizen, got into an altercation and argument over a parking spot. In surveillance video, Abdel Jalil shared, you can see him and the man got into a shoving match. I wasn't the one who started the fight, and I provided a recording video from the restaurant nearby, which I believe proves that, but the authorities didn't even look at it. Abdel Jalil was charged with assault, but he said that wasn't the only accusation he was facing. The other man told officers that I cursed the police, that's not allowed. He said he was told to postpone his trip back home to Canada and stay in the UAE until a scheduled meeting with the prosecutor, which took place several weeks later in June. After that meeting, I was sent to Al Sadr prison in Abu Dhabi. He told, no questions, no due processes, no convictions. They kept me in state security prison for 10 months, and after that they said, okay, deportation. Neither Abu Dhabi police nor UAE government officials responded multiple requests for comment on his claim. While frustrated over his claim of no due process, Abdel Jalil also said he was poorly treated while in prison and frustrated with the response to his repeated cries for help to the Canadian embassy in the UAE. He suffers from a variety of health conditions including PTSD, sleep apnea and diabetes, and said his request to prison officials for medicine he depends on was denied repeatedly. Every other day, I would leave distress voicemail services messages to the Canadian embassy to ask them to intervene. Eventually, 2 embassy officials paid him a visit in the prison. I told them, guys, I need your help. My health is not good. They keep cutting my medication. I'm not even sure if I'm going to make it out or not. They said, okay, we'll send a diplomatic letter from the Ministry of Foreign Affairs, Canada, to the Ministry of Foreign Affairs in United Arab Emirates. Abdul Jalil said he was told 3 letters were sent to his behalf, but claims no medical treatment was ever provided. Their pressure did nothing. I felt abandoned as a Canadian citizen. Upon his return to Canada, he began sending messages to government officials in an attempt to get answers as to what happened, sending emails to his Member of Parliament, MP, Global Affairs Canada, and even the Office of the Prime Minister. Please be assured that your communication has been received and carefully read. A reply from the Office of the Prime Minister read, with this reply, I'm forwarding you your remarks to Canada's Federal Minister of Foreign Affairs, the Honorable Anita Anand, for her information and consideration. Global Affairs also responded to his request, saying they would take a look at this case. In a statement to Speaker's Corner, a Global Affairs spokesman said they did advocate on his behalf. Global Affairs Canada is aware of the detention of a Canadian citizen in the United Arab Emirates. The spokesperson went on to say that Canadian officials provided consular assistance to Abdul Jalil and were in contact with local authorities. Consular officials can request that foreign panel authorities address health-related concerns of Canadian detainees. However, Canada has no authority to compel foreign officials to provide a specific medical intervention. Citing privacy issues, the agency could not comment further. According to Canada's annual consular data report released this month, Global Affairs opened 1,384 cases to address Canadians detained abroad during the 2023-2024 fiscal year. Abdul Jalil is far from being the first Canadian to claim Global Affairs did not do enough to assist after detention abroad. They have been sued in the past many times, but from what I have found in my research, many of those cases were dismissed and did not lead to any real change. Abdul Jalil said there needs to be more pressure on the government to do more for people like me. In 2018, the Office of the Auditor General of Canada performed an audit focusing on whether Global Affairs Canada responded adequately to requests for consular services from Canadians traveling or living abroad. While the audit found overall, Global Affairs Canada successfully provided consular services during the international crisis and deployed additional resources to help Canadians abroad, it also found room for improvement. The audit found in cases involving allegations of mistreatment or torture of Canadians detained abroad, consular officers took immediate action to contact detainees and make in-person visits when possible.
ਪਿਛਲੇ ਸਾਲ ਮਈ ਦੇ ਵਿੱਚ ਇੱਕ ਕੈਨੇਡੀਅਨ UAE ਨੂੰ ਗਿਆ, ਜਿੱਥੇ ਕਿ ਉਸਨੇ ਜੋ ਉਸ ਦੇ ਨਾਲ ਵਰਤਾਅ ਹੋਇਆ ਉਸ ਦੇ ਬਾਰੇ ਉਸਨੇ ਹੁਣ ਤਫਤੀਸ਼ ਦੇ ਲਈ ਮੰਗ ਕੀਤੀ ਹੈ ਔਰ ਨਾਲ ਦੀ ਨਾਲ ਅਗਾਊਂ ਸਮੇਂ ਦੇ ਵਿੱਚ ਸੁਧਾਰ ਦੀ ਵੀ ਆਸ ਕੀਤੀ ਹੈ। ਜਲੀਲ ਜਿਹੜਾ ਕਿ ਮਈ ਦੇ ਵਿੱਚ UAE ਦੇ ਵਿੱਚ ਗਿਆ ਸੀ ਔਰ ਉੱਥੇ ਉਸਨੇ ਦੱਸਿਆ ਕਿ ਕਿਸ ਪ੍ਰਕਾਰ ਉਸਨੂੰ 10 ਮਹੀਨੇ ਜੇਲ੍ਹ ਦੇ ਵਿੱਚ ਰੱਖਿਆ ਗਿਆ, ਪਰ ਉਸਨੂੰ ਕੁਝ ਵੀ ਹੈ ਜਿਹੜਾ ਨਹੀਂ ਦੱਸਿਆ ਗਿਆ, ਇੱਥੋਂ ਤੱਕ ਕਿ ਉਸਨੂੰ ਉਸਦੀ ਜਿਹੜੀਆਂ ਦਵਾਈਆਂ ਨੇ ਉਹ ਵੀ ਉਸਨੂੰ ਨਹੀਂ ਦਿੱਤੀਆਂ ਗਈਆਂ। ਉਸਦੇ ਵਿੱਚ ਪੂਰੇ ਵਿਸਤਾਰ ਦੇ ਵਿੱਚ ਜਾਂਦੇ ਹੋਏ ਉਸਨੇ ਕਿਹਾ ਕਿ ਉਹ ਪਾਰਕਿੰਗ ਸਪਾਟ ਦੇ ਲਈ 2 ਦੇ ਦਰਮਿਆਨ ਹੋਈ ਜਿਹੜੀ ਤਕਰਾਰ ਹੈ ਉਸ ਦੇ ਕਾਰਨ ਉਸਨੂੰ ਜੇਲ੍ਹ ਦੇ ਵਿੱਚ ਬੰਦ ਕਰ ਦਿੱਤਾ ਗਿਆ ਔਰ ਲੱਖ ਕੋਸ਼ਿਸ਼ਾਂ ਦੇ ਬਾਵਜੂਦ ਵੀ ਉਸਨੂੰ ਜਿਹੜੀ ਸਹਾਇਤਾ ਮੁੱਢਲੀ ਜਾਂ ਉਸਦੀ ਮੈਡੀਕਲ ਸਹਾਇਤਾ ਉੱਥੇ ਨਹੀਂ ਮਿਲੀ, ਨਾ ਹੀ ਉਸਦੀ ਕੋਈ ਆਵਾਜ਼ ਹੈ ਉਹ ਵੀ ਸੁਣਾਈ ਦਿੱਤੀ ਗਈ। ਔਰ ਜਦੋਂ ਉਸਨੇ ਗਲੋਬਲ ਅਫੇਅਰ ਦੇ ਨਾਲ ਸੰਪਰਕ ਕੀਤਾ, ਉਹਨਾਂ ਵੱਲੋਂ ਵੀ ਪਾਈਆਂ ਚਿੱਠੀਆਂ ਨੇ ਜਿਹੜੀਆਂ ਉਸ ਦੇ ਨਾਲ ਵੀ ਕੋਈ ਸੁਧਾਰ ਨਹੀਂ ਆਇਆ। ਉੱਧਰੋਂ ਗਲੋਬਲ ਅਫੇਅਰਸ ਨੇ ਵੀ ਇਸ ਗੱਲ ਨੂੰ ਸਪਸ਼ਟ ਕੀਤਾ ਕਿ 2023 ਤੇ 24 ਦੇ ਵਿੱਚ ਤਕਰੀਬਨ 1384 ਇਹੋ ਜਿਹੇ ਲੋਕ ਸਨ, ਕੇਸਿਸ ਸਨ ਜਿਹੜੇ ਕਿ ਮੁਲਕ ਤੋਂ ਬਾਹਰ ਸਨ ਔਰ ਉਹਨਾਂ ਨੇ ਗਲੋਬਲ ਅਫੇਅਰਸ ਤੋਂ ਆਪਣੀ ਜਿਹੜੀ ਮਦਦ ਦੀ ਗੁਹਾਰ ਲਗਾਈ ਸੀ। ਉਹਨਾਂ ਨੇ ਇਹ ਵੀ ਗੱਲ ਕੀਤੀ ਕਿ ਅਸੀਂ ਆਪਣੇ ਸਿਟੀਜ਼ਨ ਦੇ ਪੱਖ ਤੋਂ ਗੱਲ ਤਾਂ ਕਰ ਸਕਦੇ ਹਾਂ, ਜਿਹੜਾ ਫੈਸਲਾ ਹੈ ਜਿਹੜਾ ਕਿਸੇ ਵੀ ਮੁਲਕ ਦੇ ਸਥਾਨਕ ਜੋ ਸਿਸਟਮ ਹੈ ਉਹਨਾਂ ਦੇ ਮੁਤਲਕ ਹੀ ਹੁੰਦਾ ਹੈ।
Canadian border agency 70 kg of cocaine at Osoyo's port of entry. The Canadian Border Services Agency says it sees 70 kilograms of cocaine being smuggled into Canada at the Osoyoos port of entry. On June 11th, officers found bricks of the substance in a Canadian citizen's pickup truck who was returning to Canada from the United States. This is the largest cocaine seizure at this port of entry and represents an estimated 140,000 individual doses, the CBSA said. The CBSA says agents arrested the driver, who was then transferred into the custody of the RCMP.
ਅਸੋਇਸ ਵਿਖੇ CBSA ਨੇ ਜੀ ਇੱਕ ਪਿਕਅਪ ਟਰੱਕ ਦੇ ਵਿੱਚ ਤਕਰੀਬਨ 70 ਕਿਲੋ ਦੇ ਕਰੀਬ ਜਿਹੜੀ ਕੋਕੇਨ ਹੈ ਉਹ ਜ਼ਬਤ ਕੀਤੀ ਹੈ। ਔਰ ਦੱਸਿਆ ਜਾ ਰਿਹਾ ਹੈ ਕਿ ਪਿਕਅਪ ਟਰੱਕ ਦਾ ਡਰਾਈਵਰ ਹੈ ਜਿਹੜਾ ਉਸ ਨੂੰ ਗ੍ਰਿਫਤਾਰ ਕਰਕੇ RCMP ਦੇ ਸਪੁਰਦ ਕਰ ਦਿੱਤਾ ਗਿਆ। ਔਰ ਤਫਤੀਸ਼ ਦੇ ਵਿੱਚ ਹੈ ਜਿਹੜੀ 70 ਕਿਲੋ ਜਿਹੜੀ ਕੋਕੇਨ ਹੈ ਉਹ ਬਰਾਮਦ ਕੀਤੀ ਗਈ ਹੈ, ਜਿਸ ਦੀਆਂ ਕਿ 1,40,000 ਜਿਹੜੀਆਂ ਡੋਜ਼ਸ ਸਨ ਉਹ ਬਣ ਸਕਦੀਆਂ ਸਨ। ਔਰ ਹੁਣ ਇਸ ਜਿਹੜਾ ਡਰਾਈਵਰ है उसਨੂੰ अरेस्ट करके RCMP ਦੇ ਸਪੁਰਦ कर ਦਿੱਤਾ गया।
इसी के साथ हमें दीजिएगा इजाजत। खबरां दा लेखा जोखा के इस सेगमेंट से until next time, goodbye।